Hello, my name is Natalie Gonzabay. I'm going to talk about cortisol, physical activity, and weight loss in a randomized clinical trial. Definition. Cortisol is a steroid hormone that regulates a wide range of processes throughout the body, including metabolism and the human response. It also has a very important role in helping the body respond to stress. Application in nutrition. With conflicting evidence, it's unclear whether food intake impacts cortisol levels. As a result, dietitians can provide clear evidence-based dietary recommendations to clients who seek foods to help lower cortisol levels. A well-balanced calorie-controlled diet, limiting added sugars, sodium, and saturated fat always can be recommended, and barriers for consuming such a diet can be explored, focusing on the emotional aspect of eating. The nutrition professional also can inquire about anxiety or other such disorders and make a referral to a physicalist for further evaluation if deemed appropriate.
Hi, I'm Charlotte Lawson, a registered and licensed dietitian here in Tampa Bay, Florida. And you may have some questions on how you can eat to help promote a good cortisol level in your body. Where cortisol is like a stress hormone in our body, so not only what we eat, but our lifestyle really can affect these levels. Make sure that you're trying to avoid added stressors in your life, make sure you're getting enough fluids and enough appropriate sleep. Also try to avoid things high in caffeine and high in additives, especially like those simple added carbohydrates. They tend to spike our insulin and digestive process a little bit quicker and therefore can just add to that cortisol level as our body has to deal with that extra stressor of digestion. Now, trying things in our more complex form, like your fruits and vegetables and the whole grains, these are really recommended, along with that added fiber. The more things we can eat in our whole form, the more our body has to take time to digest, and it's a slower, more calming process. Again, not just with diet, but lifestyle. Overall, maintaining a healthy weight has improved cortisol levels as well. So if you need to lose a little bit of weight, aim for a negative calorie balance, meaning you consume less calories than your body works off or burns off. And this can be a combination of reducing calorie intake or increasing exercise. It has been also proven that to help reduce stress in general, regular physical activity on an everyday basis is really optimal. And if you can aim for 30 to 60 minutes, I know it sounds like a lot, that's really going to show you that benefit. So appropriate weight, getting good sleep, staying up on those fluids, trying to maybe avoid the simple carbohydrates along with that caffeine, and again, good exercise per day. Hopefully, with those couple tips, you can keep yourself at a good cortisol level. I'm Charlotte, and eat happy.
Pros and cons. Physical activity promotes many favorable effects on the human body, such as weight control, reduced risk of certain major chronic disease, strengthening of tissues, and improvement in mental health and energy. Many of these benefits are a result of an action of hormones in the body. Growth hormone is released during and after intense anaerobic exercise. The production of cortisol, the stress-related hormone, are also improved through regular exercise. Consequence. Excess cortisol stimulates glucose production. This excess glucose then typically is converted into fat, which gets stored. A number of research studies show that fat cells can, in the presence of too much adrenaline, become resistant to the effects of adrenaline. At the same time, high levels of circulating cortisol increase the risk of obesity and increased fat storage. Of particular concern is abdominal weight gain, one of the most dangerous types of obesity, and one that contributes to an increased risk of metabolic syndrome, diabetes, and heart disease.
It is also released during times of acute stress, which triggers our fight or flight response that gives us a quick jolt of energy to motivate us and react timely. However, chronically elevated levels of cortisol can pose many health risks. Let's start with consequence number 1. Chronically high levels of cortisol can cause blood sugar level imbalance and over time can increase your risk for type 2 diabetes. Imagine you're being attacked by a coyote. Your cortisol levels spike, which then signals your liver to release glucose into the bloodstream. Why? Because your body's trying to give you all the energy it needs to run as fast as possible. At the same time, cortisol halts the signal of insulin. Insulin is a hormone released by the pancreas to signal the cells to uptake sugar. The last thing your body's trying to think about is storing sugar for later use. All it cares about is keeping you alive at the present moment. However, currently, most of our stress doesn't require us to run or flee from a predator. So then what happens? Well, blood sugar levels rise and continues to be high because the signals of insulin are blocked, essentially starving our cells. This is also known as insulin resistance. Over time, this could eventually lead to type 2 diabetes. Let's move on to consequence number 2. Chronically high levels of cortisol can lead to weight gain. Earlier, we had mentioned that cortisol blocks insulin's signal, essentially starving our cells. Since the cells are starved of sugar, the brain sends hunger signals, which could lead to overeating, where any unused glucose in the body is then stored as fat. A secondary function of cortisol is that it signals the transfer of triglycerides from storage into visceral fat cells. This is the type of fat found under your muscles and surround your internal organs around your abdomen. Now, let's move on to consequence number 3. Chronically elevated levels of cortisol can lead to gastrointestinal issues. Under constant stress, there's less blood flow directed to your stomach and small intestine. This can lead to indigestion and even ulcers in some cases, and a compromised mucosal lining, which ultimately means poor breakdown of food and absorption of nutrients. Remember, optimal digestion requires us to be in a calm and relaxed state. This means when we're eating, we should be sitting down and relishing every bite.
Conclusion. Elevated cortisol levels may exert detrimental effects of cognition and contribute to some pathologies. It hypothesized that higher activity levels would result in lower cortisol levels in these time periods. Steer clear of weight loss products that make unproven claims. Instead, focus on reducing your calorie intake and increasing your activity level. For lowering stress, explore stress management techniques. Thank you.